this session mostly it will be involve talks from distinguished academicians from IIT Bombay and ICT Mumbai, and along with innovators from industry. And mostly they will be covering like nanoscale lipid nanoparticles for drug delivery to the food technology or nutraceuticals. So it will be very interesting sessions for audience also. Um, so we will start first with Professor Mahesh, who is HOD and professor at IIT Bombay, and his group is working mostly on nano suspensions, lipid nano assemblies, and suspension dynamics. So over to you, Professor Mahesh.
Yeah, so thank you very much, Sopal. What I like to present to you today is some work that was initiated more than a decade back by my former PhD student R. Sundar, who's now a professor in NIT Surat, and then very recently taken up by my brave new PhD student Rakesh Kumar Sidhu, because all the knowledge that we had at that time had all gone, so he had to reinvent many things and relearn things with the process, right? Okay, so we had a very nice introduction in the morning from Professor Rochesh Thakur, and later from Mr. Arun Kedia about liposome and so on. Now, as a typical teacher, I have put out a scan of some of the notes that I had, but these are very useful because the question that we were asking initially was, what is the smallest size of liposome that is possible? And as we were told that at a very low concentration, they self-organize into small lipid bilayers. But then for them to form a liposome, they have to fold and form this shell or a sphere. And what the idea is to essentially balance the edge energy, because you have the hydrophobic tails who do not like water, so they don't want to be exposed. So they rather therefore get enclosed in this shell. But then to do that, you have to bend this particular membrane into a sphere. So if you balance the two energies, and for two typical lipids, DMPC and DOPC, you find that the smallest radius of the shell that you get is about 20 nanometers or so. So really it is possible to go down to such sizes. And in manufacturing of liposome, they have very different technologies. There are two which are really commercial, which I have put in here. First is a microfluidic mixing, where you have two ends in a white channel, one which brings in a lipid solution, the other brings in an aqueous solution. And there is a very rapid mixing that takes place. In this particular image, there are also baffles. And the idea is that if you have a very rapid mixing, then the concentration of lipids is very low. And as we saw, that the size that you can get down to as low as 20 nanometers. So if you control the parameters, you should be able to do that. And so this is one publication it's an ACS publication, which shows that you can indeed go down to 20 nanometers using this technology. And commercially, this is what is being used for mRNA and RNA delivery. The only challenge there is at the end of the process, once you get the liposomes, you have to separate the organic solvent and get that. So there is this critical separation step when the volumes are very large, and of course then that's an important step. The other one was high pressure homogenization, which Mr. Kedia also mentioned. The idea is to first form these liposomes and then send it at very high pressure through very narrow wall. And the high shear is what breaks it up into tiny sizes. Again, it is what is used in industry. The disadvantage, of course, is that high shear or heat may degrade the biomolecules. So as I said, more than a decade back when we looked at it, we thought that can it be done differently? We as chemical engineers come across various different unit operations, and one of them is what is known as a packed bed. And so what we did is the following. We took a packed bed, and these packed beds are of alumina particles. These particles are of about anywhere from 200 nanometers all the way to about 600, 700 nanometer. These are particles. We took them inside a tube, we packed them with these particles, and then took them to a high temperature so that the particles would sinter. Not completely deform, but they sinter and they're very well lodged inside that inside the tube. And then we sent a lipid solution through it. And then we had a nitrogen gas pushed through the same thing. The lipid solution has it's a solvent with the lipid. And so when you pass the nitrogen gas through that, the solvent evaporates. And we believe that we will have these lipid particles coating the surface. And then we send an aqueous buffer which may or may not contain the drug. And then we see what comes out on the other side. Okay. What you see here is a size distribution of only the particles, the alumina particles which make up the packed bed, and the size, as I said, is anywhere between 200 to about a micron. This is how the packed bed looks like. These are not spherical particles, very odd shape and very sharp curvatures on the surface of the particle, very complex morphology. And this is an X-ray tomography of how a packed bed looks like. And so this is after drying and after sintering. And there are, of course, these macroscopic cracks, but we find that they do extremely well in our experiments. Okay. And so at that time, Sundar did these experiments where he varied the buffer flow rate. So once you have these lipids inside the packed bed, you start flowing the aqueous buffer. We varied the buffer, we varied the lipid concentration, we varied the packing concentration. We also varied the particle size. And indeed, we found that almost all the particles were less than 100 nanometers. So here was a very simple method, doesn't use microfluidics or anything. And you are easily able to generate 100 nanometer particles. And what is interesting is it also did not depend upon the size of the alumina particles. If you recall, they had 3 different sizes. And so what we hypothesized is that it is those sharp curvatures which leads to the formation of patches of these, maybe the bilayers which are sitting. And when the aqueous buffer goes through, it hydrates them and those fold. And the size of those bilayers is determined by those high curvature surfaces. And that limits the size of the bilayer. And therefore, we are able to get these very nice liposomes, which are sub 100 nanometer, right? And of course, the proof of the pudding is in eating, as they say. And so we took TEM and SEM images, and you can see that these were extremely monodisperse. And so we were very happy with these results at that time. It is a very simple process. And then what Sundar did is that he converted this into a continuous operation. And the idea was that you have these 2 syringe pumps. Of course, we are all doing this at the lab scale. One of them had the buffer, the other had the lipid and the solvent. We did not have any drug, but the drug that we say is either it can be the buffer or in the lipid. And then we had a nitrogen tank which was connected to the same the tube in which we had the packed particles or the packed bed. And so the lipid plus solvent would go in first, and then the nitrogen wall would open and that would dry so that you would have this dry lipids on the surface of these particles. And then there would be the liquid buffer that would be then pulled in there, and then slowly this is pushed by the nitrogen pressure itself, and then you get these drops coming in. And so you just automate it so that there are alternate plugs of this lipid and drug with the nitrogen drying first the lipid, so the solvent off, and also pushing the liquid plug, that is the aqueous buffer plug, and we collect it. So we patented that. And we also thought that, of course, that maybe this can also be converted into a very small compact device where you can have the lipid pre-loaded into the packing itself. And then all one has to do, the user has to do, if this idea really works, is to just take a liquid with the drug and push it through so that at the other end what you get would be the nice encapsulated drug. So that was the idea. Of course, we need to optimize this packing and so on so that the pressures that you apply are not very high. So this is what Sundar had done. And then only a year back, as I said, Rakesh joined my group and he wanted to take this further, but really try the encapsulation bit. And these are the very initial experiments, very preliminary experiments that I'm going to talk to you. And the idea was, of course, to try and see if this technology or simple method could be used to encapsulate RNA. And so we took a mixture of lipids, as this is very well known now. We had the DSPC as a helper lipid, cholesterol, to give the mechanical stability, a cationic lipid, and a pegylated lipid. For the encapsulation, we used an RNA that we got from yeast. This was not a single length. Had a wide distribution. These are very initial experiments to see whether it works or not. When he produced the lipid nanoparticles, these are not liposomes, these are lipid nanoparticles, the sizes were large we expected. So we need to optimize the size of these lipids. But the size range is very good. It's very tight. The PDI is only a 0.15. The zeta potential is around 10 to 40. So the idea is hopefully they will not agglomerate. That's the range that we are getting. And so here are the very preliminary results of this. So he had done these a few times, and he gets an encapsulation efficiency of 70%. So these are very preliminary experiments, as I said, where he's trying to encapsulate mRNA. But we are very happy to see that this very simple method, first shot, seems to be giving us about 70% encapsulation. So going forward, what we want to do is optimize this, and then in fact take RNA of a fixed length rather than having this large distribution that we got from the baker's yeast, and do the further experiments. So I'd like to conclude now, is that we are able to produce highly monodispersed liposomes using this very simple method of packed beds. At least with the earlier lipids that we used, where we produced the liposomes, they were all of sub 100 nanometer range, with a size distribution which was very tight. The final size, we believe, and this is a hypothesis, is not determined by the size of the particle which makes up the packed bed, but really the roughness which is there on the surface of the particles. And the reason we say that is because we took different sizes of these alumina particles which make up the packed bed, and still the distribution, the liposomes that we got was very, very similar. Okay, and since they are all alumina with the same kind of surface morphology, we think that is a surface morphology rather than the bulk size of those particles that determines it. It's a one-step process in the sense that you don't have a separation that you have to do later on, where you have to separate the aqueous media from the organic media. So that eliminates, we believe, the post-processing. The RNA encapsulation that we are talking about, that is of interest here, seems promising from these preliminary results. We really need to optimize it, play around with the ratio of the various lipids that are there, play around with the packing of these particles, change the flow rate, and so on. And as I pointed out later, maybe it can be kind of a point of care therapeutics for liposomal drug delivery, where you can just have a cartridge with the lipids which are coated in this kind of a packed bed, an aqueous solution. You just push it at the point of delivery, and you get the solution straight away injected, and so on and so forth. And so with that, I like to conclude this talk, and will be happy to answer any questions. Thank you.
Yeah. Thank you, Professor. It was very nice and interesting research you performed. And now this is time for question and answer. Yeah.
Yeah, so two questions. One
Yes,
was what was the RNA length range or dispersion? And second is what was the drug to lipid ratio to get such poor encapsulation efficiency, which supposedly with such a high efficiency method?
Yeah, absolutely. So this is something that we are still looking at. The RNA, I think, is somewhere around 50 base pairs to about 150, 200 base pairs is what we think. And the ratio that we see is the LNP to RNA is about 1:8. Maybe if we can bring that down, maybe the efficiency will go down. And as I said, that these are very initial experiments. 70% I know is not at all acceptable in this thing. But what I feel is that these are encouraging, and we hope that by optimizing the process, we can increase this percentage. And for that, it will be very helpful to get more inputs from all of you. Yeah. Yeah. Yes.
Very interesting talk, sir. I would just like to ask, because you have developed liposome particles of different sizes through microfluidics. So, is there any biophysical technique or any in vivo technique that your group might have done to see how these different sizes actually affect the performance in terms of cellular uptake or release of the bioactives? Because uh, as we know that the different size of the particles also affect their efficiencies.
No, you're absolutely, it's a very good question. We have not done any of that. And I think 300 nanometers that we are currently given is probably be eliminated by the system itself. So we need to get it to 100 nanometers or below. So we are very much aware of that. But we have not done any cell uptake studies. As engineers, we're looking at the process. And what we are hoping is whatever is the industry standard, can we get to that using this particular method? That's what we are aiming at. Maybe the next one would be to do the cellular uptake and look at whether there is indeed an absorption. Yeah. Thank you.
Thank you.
Yeah, so that was a real interesting and simple approach, very promising. I had just one concern about the use of alumina, which you may need to look at if you're
Yeah.
looking at scaling,
Yeah.
whether that could contaminate the liposomes
Right.
even in nano quantities. So
Yeah,
that is
yeah.
something you need to keep in mind as you take this forward.
No,
That's
you're
it.
absolutely right. We have worried about it a lot. Ensure that there's nothing coming out after we make the packed bed. We keep flowing the liquid. We take that, put it in our DLS to see if we are seeing anything. We do SEM, TMs. But you are absolutely right. That's the worry that we always have. That although we have done the sintering and taken all precautions, there should not be even a few alumina coming out, which could be. Yeah,
So maybe
bad.
some test for alumina, specifically in picograms or nanograms, something like that, because
Yeah.
that could be very dangerous.
Yes.
And it could, kind of vitiate everything that you've
Yes,
done.
eliminate all the
Yes.
advantages if at
Yes,
that.
yes,
Yeah, thank you.
absolutely.
Thank you.
Thank
yeah.
you.
Hello, Professor. It's actually a good study, actually. From an engineer to engineer, I see the potential there,
Yes.
scaling it up. Have you compared it with any existing LNP making?
Yeah. So,
mechanics?
the microfluidics will give you about 95%.
Yes.
Yeah. I'm very much aware of that. So that's why I said that, as I just mentioned, 70% is not acceptable.
Mm-hmm.
Absolutely, I understand that. But as these are results of the last couple of months or so, so we are trying to optimize it. And as I also said that when we talk about very high efficiencies, the mRNAs are all of fixed length. They are maybe less than 50 BPs, I think so.
Yes.
Right?
mRNA varies
so
from
here
length
we have
to
a
length.
much larger range and we don't have control on that. But we thought that let's go ahead and see if we see any encapsulation using this method. That's what's the really. So these are very preliminary results, but we are hoping that going forward we will be able to tackle those issues.
I understand, because why I'm trying to pitch in this
Yes.
is, let aside mRNA vaccines.
Yeah.
That is a new kid in the block and people can afford it.
Yeah.
Back in the US, here also, people can afford it. The regular traditional vaccines, which are still made by homogenizers, there is a stability issue on long terms.
Mhm.
But those vaccines, the companies or industries are not willing to use microfluidics because it is very expensive. And right now, the scalability is not there.
Right.
Up to 100 liters, it is there, because from my Alnylam days, we can say that
Yeah.
we can't make batch more than 100 liters.
Right.
But vaccines, we make it in tons.
Yes.
So if these things can be economical and scaled up,
Yes.
I see a potential there. That's why I'm trying to.
Oh no, thank you very much. I'll be very interested to discuss this with you when we have the break. Yeah.
Okay. Thank you.
Thank you very much. Thank you.
Sorry, just two quick comments.
Yes.
So, would you be able to eliminate the risk of alumina by adding a centrifuge step post the LNP, which should be a very, very simple step?
Very good idea. Yes, I think that should be possible. Once we have collected them, just do the centrifuge. Absolutely, very nice idea.
Yeah, it could be done in batch mode, continuous mode. It's a very,
Absolutely.
very tiny thing.
Yeah, very nice. 300 nanometer, because their densities are extremely high, alumina, compared to anything else that is in the system.
Exactly.
Yeah.
The second comment is that when we talk about size reduction, just one word of caution. If you have a content of exceeding 20% of the nanoparticles less than 80 nanometers, then the US FDA has a very, very stringent guideline on those nanoparticles.
Okay.
So going much below 100, can be extremely counterproductive for the regulatory point of view.
Right.
And frankly, I don't see any big advantage going much below 100. I mean, so
Right.
I mean, between 120 and 80, what's the advantage? And
I
it's
agree with
it's
that.
not numerical.
Sure. I agree with that. Yeah.
If it goes below 50 or closer to 50 nanometer, the drug delivery is impacted because it can deposit in your bone.
Okay.
So it's good